as Dr. George Lockwood, and I'm in the executive board of the International Society of Chemotherapy. And this is Dr. Arnoud, who's a clinical professor at Maastricht University and is an invited keynote lecturer at the 5th World Congress in Chemotherapy to be held in 2012 in New York City. So what I'd like to do, Arnoud, is to get some brief overview of the presentations you'll be doing. And you'll be doing the keynote lecture as well as a pre-conference workshop on working with avoidant patients in chemotherapy. And so if you could touch a little bit on both of those topics. The invited keynote is going to be on the importance of training and the therapeutic relationship in chemotherapy. And maybe we can start with that if you want to say a little bit about the importance of training and what you have been finding out about that.
Yeah, I will present findings of a large randomized controlled trial we did in the Netherlands with comparing chemotherapy to treatment as usual, which was mainly psychodynamic treatment, supportive or more insight-oriented psychodynamic treatment, and the third condition that was a new version of client-centered therapy. And we found that chemotherapy after 3 years, 3 years after the treatment started, was superior to the other treatment conditions. Now, most of the personality disorders were cluster C personality disorders, so mainly avoidant, dependent, and also obsessive-compulsive personality disorder. So 90% of the patients had one of these disorders as primary diagnosis, the main problem. First, I was a little surprised about the findings, because when we did an intermediate analysis, so when the data were not complete of the follow-up, we couldn't detect clear differences between treatments. So it seems to be the case that there is a long-term effect. So in the final end, chemotherapy does better than the other treatment conditions. And looking to the reasons for this effect, partly it seems to be the case that it has to deal with the kind of training the therapist, the chemotherapist of the trial received. Now, let me explain that a little bit. We initially trained a group of therapists, and later, because one center withdrew, we had to train a second group of therapists. And the other centers also sent in new therapists, so there's some overlap. The second wave of therapists was trained in a very structured way, didactic way, with a lot of clear examples in video clips or by a live role play, and then they had to practice the techniques themselves in pairs. Whereas the first training was more, more lecturing, explaining in verbal ways how to do it, also showing examples, but not so much in a structured, experiential way. And
so the showing examples would be video clips of someone demonstrating the techniques, is that right?
Yeah. So, and then the video clips in the first training, I think, were more extended. So they showed more complete session, for instance. Whereas in the second training, it was a short video clip of a specific technique. Now, in the second group of therapists turned out to have much better effects than the first group of therapists. And the second group had less dropouts and had more patients recovered from their personality disorder, and less depression as a secondary diagnosis than the first group of therapists. So I will present this data in more detail on the conference, but I think the important message is that it makes a big difference how you train your therapist in a new treatment. And I think it's quite unique that we could demonstrate that the way you treat a new therapist in a new technique, in a new approach, makes a difference on the level of patient outcome. So it's not much studies that have investigated this. Those generally acknowledge that you should have a good training, but as far as I know, there's a lack of studies demonstrating that it really makes an effect on how well patients do with and after the treatment.
Yeah, that's really interesting. So it narrows in on the experiential work, the actual direct feedback, and getting presenting with particular problems and working with that.
Right.
Yeah.
And I think that as psychologists, you can understand it in the sense that much of treatment is the application of procedures. So we call that procedural knowledge. And it's stored in the brain in a different way than the sort of explicit semantic knowledge, which is more theory.
Mm-hmm.
So to become good in procedures, you have to practice, and you have to practice on an experiential level. And in that sense, therapy is not very dissimilar to music or sports or whatever.
Mm-hmm.
To be good, you have to train to do the procedures yourself, and that creates a better memory base than just verbal information.